name is Alison Werner, and I am joined today by my co-host, Keri Stevens. We are the co-chief editors of Plastic Surgery Practice. Thank you for joining us for today's podcast. Today, we are joined by Dr. Corey Maas, a board-certified facial plastic surgeon in San Francisco and the current president of the American Academy of Facial Plastic and Reconstructive Surgery. He is here to talk to us about the Academy's annual member survey released in February. Dr. Maas, thank you for joining us today.
Thank you for having me.
Thank you. Well, let's just start with a simple question. What surprised you most about the findings in this year's survey?
Well, I think it was the dramatic increase. I think we were all surprised, frankly, on the dramatic increase of 2020 over 2021. We saw a slow rise because of the sort of paralysis that happened in early, in the spring of 2020. But then over the summer, there was a gradual increase, but it really exploded, through the fall and winter with cases rising. And, we're talking 60% or more increase, and some practices even more. And so that's not a normal year over year increase in procedures performed. It was dramatic.
Yeah. Well, talking about those procedures, the survey has the most common surgical procedures performed by Academy members in 2021 as rhinoplasty, facelifts, and blepharoplasty. Is this consistent with previous years, or was there a shift here?
I think it was, well, a little bit of both. If you just think about the overall number went up so dramatically of all procedures, those stood out as being procedures that were performed with greater frequency for, I think, a number of reasons, which we can get into them. But the biggest one being probably the top two or three is, number one, people were seeing themselves every day on Zoom, Microsoft Teams, whatever your video conferencing thing is, themselves in ways they may not have ever seen themselves before, because it's a different image than looking in your well-lighted mirror. Number two, people had nowhere to go. They had nothing to spend money on. You couldn't go to restaurants. You couldn't travel. You couldn't even go to retail, frankly. So they started investing in themselves. And then, doctors' offices are safe. I mean, we all had policies in place, and, I think our patients trusted us to follow the CDC guidelines and maintain those. And certainly we did during that time period. And so there was no exclusion to doing these things based on need or desire or whatever. It was really something that was the perfect storm, if you will, for those of us that do things. So, that's a long answer, but the short one is that if you're wearing, and the fourth part was that you're wearing masks during this time, and it's a great opportunity if you're wearing a mask. I mean, people didn't even find it unusual to be on a conference call like a podcast here with a mask on. It was okay. You could do that. Yeah. So you could function normally with a mask that disguises face. Certainly all of the facelift and rhinoplasty stuff is disguised. The one that's not is blepharoplasty, but that's a fairly quick recovery type of procedure. You get a little bruising on the upper eyelids, but it almost looks like purple eyeshadow. So people aren't out for that. And then, of course, the other big part of the explosion was in minimally invasive or non-invasive procedures too. It was a big part.
Well, talking about the minimally invasive procedures. So in the report, it was neurotoxins, so Botox, fillers, and skin treatments were the most common. Are those procedures were those procedures in previous years at the top, or has there been any shift in which procedures are kind of gaining traction there for the minimally invasive?
So historically, so that, as they've, as the science and understanding and comfort level with the public has increased every year over year, better consumer awareness and good messaging from both physicians and industry. There was a much greater comfort level with the cosmetic injections, whether the Botoxins, that's Dysport in this country, Dysport, Xeomin, Jeuveau, and Botox, of course, the well-branded one, but also the fillers, which were used quite extensively and became really, there was a shift from Botox being the entry treatment to a younger group of people coming in and doing fillers, in particular for lip enhancement. And that was a shift, but it was a pretty big number. And I don't, again, what demo group they're in. I would guess Gen Z or whatever the group is that are in their 20s now, and they were doing it, and if done appropriately, it's a very nice procedure. And of course, we've all seen the overdone people too, and there's been some pushback since that time where people were kind of overcooking it, but in general, done correctly, they look really nice. And that was a big change, is that there's a younger group in the 20s where Botox people generally start in their 30s. So a little bit younger group of people started coming in too.
Do you mind? I'm going to kind of circle to a different question we were going to ask later. It was about this. The report members did report that there's a greater emphasis on earlier maintenance and age prevention, starting with the 20s and 30s, that population you were just talking about, so that they could put off bigger procedures and surgeries later on. So in addition to, the lip procedures, what other types of procedures is this age demographic doing to put off these procedures later on?
Well, look, this group is a very highly informed group who are very comfortable with, with search and sort of dissecting out the hype from the reality, and will come in generally to the office, which with sort of self-propagated education. And it makes it a lot easier in many ways for us. It can make it a little more challenging so that you can't confuse Dr. Google with Dr. Maas, but the idea, because there are sometimes they get a misunderstanding. There's got to be some filters there, but at the same time, that group is also very much aware that some of these early interventions can prevent some of the there's intrinsic and extrinsic aging. Intrinsic is very hard to manage because it's really your genes. I mean, your skin type, that you can't really get to pick those things. But the extrinsic aging, things like smoking and sun damage, which are the two probably biggest things that affect skin, they're very conscious of skincare products and sunscreen. And we've certainly gotten away from that 60s and 70s trend that was really a very brief moment in human history, because historically lighter skin has always been associated with more prosperity and not working in fields, if you will. And it was really only a couple of decades where we saw this big bump in the tan, sort of James Bond thing, where you're tan and that means you have more free time, and that's how you spend it. So that, fortunately, because skin cancer rates have, gone through the ceiling. It's a cumulative sun damage is a cumulative type of thing, and we can do certain treatments to help reverse that. And there's certainly topicals that can help, including the retinoids and L-ascorbic acid and whatnot. But the treatments themselves go from, sort of non-ablative types of non-ablative laser resurfacing, to particularly fractional laser, because there's very little downtime, if any, to micro needling or radio frequency micro needling in particular. The micro needling, where you're just putting a roller on your skin, probably doesn't do that much. But when you add RF or some energy where there's a little bit of thermal injury, those particular went up quite dramatically.
Okay.
Yeah.
One of the things I want to talk about is the shift in the number of revision procedures and what procedures are being revised. Can you talk about that a little bit?
Well, I think so. Revision surgery is part of what we do, and it doesn't necessarily mean anybody did anything wrong. Sometimes revision surgery is just to get a little bit more of what you already got. It might be altering a little bit of what you've already done. There are more people entering the field now, and I think there's this experiential component to it, which has several layers. The first layer is proper patient selection, matching up the right patient for the right procedure based on their desired outcomes. And that's generally where you have the happiest patients. If you offer, if they have a concern and we're addressing it with the right procedure. And that's part of the cerebral portion that has nothing to do with how good your hands are. It really has to do with figuring out what the patient's looking for and trying to match up the procedure or procedures that would best address those concerns. once you get past that step, doing, if you can match them up, you're going to have a very low rate of revision if you execute well. And some of the things that I've seen, at least, it gets to sort of stratified by that most challenging procedures are probably rhinoplasty in general is at the top, because it's a very you're blending form with function, and it's so individual. I mean, what people want that's why I always use computer imaging with our patients and show them and get them. We come up with some mutually agreed upon image that they're hoping to achieve, and if you get pretty close to that, then people are generally happy. But even with that said, the published rates of revision rhinoplasty, primary for doing it for the first time, are in the mid to upper single digit numbers. Not that many, but enough to be significant given the number that's done overall. If we're talking about revising a revision, so somebody's already had a surgery and they're coming in for a secondary or tertiary rhinoplasty, it gets a lot more complex, and it really does. I mean, this is where trusting your face to a facial plastic surgeon is the real deal, because this group in particular has a lot of expertise in working on the nose and in and on the nose, so there's a comfort level with that. And there are a lot of different techniques described. It's really about executing them. So I would say there was a big rise in revision rhinoplasty for the same reasons we've discussed, is that people can get that procedure. In revision rhinoplasty in particular, the swelling lasts a little longer than in primary rhinoplasty. And it's not dramatic, but the best results you'll see after 6 months to a year, literally. And so that means longer recovery. So people wearing masks was a good opportunity for, something that's bothered them for a very long time if they had it when they were much younger, with some of the cookie things they did in the 60s and 70s in particular.
So, okay, I want to talk about men now. So in the study, you talked about how there's a smaller chunk of the patient population undergoing both surgical and non-surgical procedures, but members report that they believe there will be an uptick. And what procedures do you think men will be looking for specifically?
Well, the obvious one is hair. So, I mean, hair restoration is unique to men, and that's not unique because I do a lot of hair restoration on women too. But that I really start both with men and women on medical hair restoration, and we do have some very good pharmaceuticals that are very helpful in particular retaining hair, but also growing new hair. And then probably a close second, or if you include the younger population in particular, because rhinoplasty is done in men and women typically around high school or college age range. There was some question, I dealt with a bunch of questions yesterday about how early you can do rhinoplasty, and generally that's going to be middle school age kids that are 13 or 14. It's pretty much fully grown by that age, and it doesn't have any impact on their on their growth of their face or facial symmetry or anything beyond that. And an eyelid surgery for men has always been really near the top of the list, because hooded skin makes you look tired. That's sort of boardroom thing, and that's why they talk about Botox in the boardroom. Part of that is softening the features around the eyes, and even as our papers we published in the early 2000s showed, you can do substantial brow lifting in people just doing Botox. But those are areas where men feel the most comfortable, I think, coming in. But once they cross the threshold, they, just like women, start talking about everything. They lay out what their concerns are, but those are the threshold crossing type of procedures.
Well, when it comes to the future of non-surgical procedures, members reported that they expect there to be more choices going forward, especially when it comes to body contouring for fat reduction and skin tightening. What procedures or technologies do you think are going to be at the forefront here?
Well, clearly right now, I think the thermolysis, fat thermolysis, the cool sculpting and non-invasive body contouring Procedures are leading the way as alternatives to, even though technically liposuction can be minimally invasive depending on the patient. Those procedures work very well and they're reliable. And now we even have body toning with some of the electromagnetic energy devices that can work on literally doing gluteal tightening, the butt muscle tightening. There's M Sculpt and Cool Tone out there that are both working basically the same type of. There's subtle differences, but same technology, and those are being used for abs. And so you get the fat removed with freezing the fat and preserving the skin, of course. And there is some skin tightening that happens with those procedures that we don't see in liposuction. I don't do body liposuction myself, other than to harvest fat for facial grafting, but I have done it in the past. But there's quite a remarkable sort of an inflammatory response that gets a little skin tightening for patients, and then you add those to the toning of the muscles, and then some of these skin quality improvement treatments can be applied to the skin, like radio frequency and doing things like VeloShape or microneedling. What I said, VeloShape is a bipolar radio frequency, or thermage, which is monopolar radio frequency, are things that can tighten skin anywhere. So you really have got all three levels. You've got the fat, you've got the body toning and muscle tightening, and then you've got the treatment of the skin quality, which historically was never done off body. We couldn't do deep chemical peels and things like that, or even certainly not ablative laser on the body. Now with fractional laser, I've got lectures on whole body fractional laser resurfacing. You don't do it all at once, by the way, but you can do it in several.
That's good.
That would be an interesting but
Okay, this is interesting. And while the report also notes the increase in bookings and treatments for both surgical and non-surgical treatments in 2021, what's the outlook for 2022? What can we expect this year?
Well, I'm not seeing any decrease. I think there's a lot of inertia that we have going now, and there's still some of the headwinds for people in terms of travel, and there's a certain fear factor out there. The pandemic, for all practical purposes, is over at this point. I'm not saying you don't take it seriously. I mean, Omicron, you should get a booster, and that's the best way. But it's really for most people who are boosted or have already had the virus. It's not much more than a cold if you get it. There are very few hospitalizations and deaths. All that said, there's a layer of caution that everyone has and certain fear factors. I think people are still, and some people very resistant to travel, and so there's a lot of still, if you're going to spend your money, why not invest it in myself? This is something I can feel safe about, and something I always wanted to do. So I think those are driving a lot of the continued interest, the inertia that I said started in the, during the heart of the pandemic, really, and the mask wearing and the Zoom calls and all that.
Yeah. Well, I wanted to shift gears just a little bit and talk a little bit about who responded to the survey. And one of the things I saw was that the number of respondents who reported being in solo practice was slightly down from 2020, about 5% lower at 47%. How has the way a plastic surgeon practices changed in recent years? Is there a movement towards group practices or corporate, or is the solo practice still primarily where it's at?
I think that, it's a very good question. What I think that the trends in general, there's not a great deal of increase in academic programs, which, have certain limited faculty, the certain number of faculty they have. But there are certainly a lot of economies of scale in sharing overhead expenses and things like that, which takes a lot of the pressure off the whole business model. If you're sharing expenses with others and there's a synergy of referrals within a practice, it just makes group practice. When I say group practice, everybody has their own areas. This is a pretty broad field. If you're talking about everything from, breast lifting and breast augmentation and, mommy makeover all the way to rhinoplasty and eyelid surgery. And very few people can be experts at all of those things. I mean, it's just too broad of an area now. So, having practices where people get plastic surgeon and facial plastic, for example, are very common and very good partnerships. And, however their expense sharing works. So we're seeing more of that type of group practice, and even some increase in multidisciplinary, where you'd have a dermatologic surgeon or a derm person involved.
The report notes that the majority of the facial plastic surgeons who reported as part of this survey were between their 40s and their mid 50s, and the percentage of younger surgeons dropped considerably since 2018. Now, the findings from the report note that it's hard to say if this is the number of younger members are actually decreasing, given the number of respondents. But are you seeing any trends in the profession about the number of new doctors entering the field?
No, I think the numbers are in the field are increasing. I think that, like any organizational membership type of group, what we're seeing is, especially with the young people, is how do you spend your money? And if you're going to invest it in your practice, you have to decide, you want to buy that new machine or hire that new employee, or do you want to, I mean, obviously, being a member of an organization is not going to be a bank buster or anything. They're just like any business. If you're not getting a good return on your investment, then it's probably something that you have to work on. I think we're having, and in general, this is happening across a lot of industries and even, churches and other things like that, where they're seeing fewer and fewer young people. And just because they're how they spend their time and, and in their free time, and then how they spend their work time and how they spend their money are all important. And there's a real value proposition with membership in organizations in general. So it's really one of my jobs as president of this organization is to try to make sure we're getting our young people, our fellows, and other young people that are interested in facial plastic surgery. It doesn't matter if you came from plastic surgery or otolaryngology, fellowship trained or not. If you're doing this, we want members to see the value, and that comes down to only a few things for membership organizations. It's are you driving interest through the branding of your specialty? Are you driving interest to the consumer through good consumer education, which nowadays a lot of the young people just feel like they can do this whole thing themselves. They got social media, they've got all kinds of outlets to do it. And it's not just through the organizations where they can get their name out there. In fact, they can be very effective with clever marketing platforms on their own. There still is the synergy of working together and the group meetings and sharing knowledge, because the field is evolving quickly, and educational programs, I think, are critical for all of us. Continuing medical education is how we all stay on our top of our game. And at the same time, there's more and more meetings out there, and they're good meetings. So that's what we see. And our part of our job is making sure that the member, for their dollar paid for membership, they're getting a good return. So that's a professional side thing. It has very little to do with the consumer, but it has to do with a younger group that's smart about investing their money. I mean, that's really what it comes down to.
Yeah, exactly. Do you guys have any meetings coming up that members should know about?
Yeah, we have our meeting coming up in May 18th in Miami, and I think it's the 18th. And that's our we're combining our aging face and rhinoplasty courses, so they're going to be running sequentially. And it's really an international group. It's a great city, and we've got really good registration. There should be a lot of, and it's, by the way, the first real meeting we've had live in almost 2 years. So there should be a lot of good to see colleagues and friends. And then, of course, our national meeting, the annual meeting, is in DC and at National Harbor, which is a new area, the DC metro area, where there's a great part of town and really close to the inside the Beltway thing, but still, it's a great meeting site. So I think what we'll be seeing a lot more young people. I've personally taken an interest in making sure our fellows and residents for sure are there, because this is a good opportunity for them to get to hear from some of the real masters that are in our field, not just from the U.S., but we have a lot of international people coming. So it's exciting.
Excellent.
That is really exciting. So this is kind of more of a broad question, but what is keeping up plastic surgeons at night? What are the key issues that y'all are just saying, that are just really...
Well, we're like everybody else. I mean, inflation is crazy. I can tell you that the cost of medical equipment and supplies, and even its ability to get to us. I mean, we're over ordering things like, things as simple as sutures and certain other drapes and things that you just wouldn't even think. Masks for a while, it's better now, but I mean, you have to bulk order them because they're back ordered, which you'd never think would happen. But those are, in part supply chain things. And then when you do buy them, they're probably twice as expensive as they were a couple of years ago or even a year ago. So that managing those costs are substantial for us. And then if you start getting into the equipment side of it, it really, these medical equipment is already really expensive. So, and their costs are up too. So building things. So it's really about managing cost. I think that's probably the things that, we kind of gnaw our teeth on. All of us want to, if they're like me, I want to employ as many good people as I can to help care for our patients. And kind of, I think successful businesses are making every effort to get people back in the workforce to help us all get back to productivity that we should be. And I'm in a lucky area in the Bay Area. There's, so much wealth here, and so many people can work from home in tech and biotech that it makes it sort of easy for me. I don't want to knock on wood. I don't want to jinx myself, but in other areas of the country, it's not the same. We just have, they're super busy. The tech giants that are all out here, Google and Facebook and Apple and, Twitter, all of them are here. So they're moving too now. I mean, they're also expanding, and they've got offices going up in Texas and Florida and the lower tax states. So but still the epicenter is all here. So we're fortunate here. Some parts of the country, I think they're facing a little more challenges as costs go up, and it's really hard to raise prices very much on patients that are just coming out of a pandemic. That's a tricky job.
Yeah, that's really interesting. That is not what I thought you were going to say, and that it definitely is really a lot of good food for thought. But okay, to end this on a really positive note, what excites you most about the profession?
Well, I think it's always been the same for me. It kind of gravitated from my professorship for 12 years at UCSF, at the University of California, San Francisco here, where, I was probably 50-50 doing reconstructive and, trauma and facial nerve injury and some things, and then cosmetic. But all of them in the end give us an opportunity to help people feel better about themselves and improve their self-image in meaningful ways. And people who get nice, and I'm not talking about this is when you provide somebody a natural rejuvenation of their look, so that they can restore the look or balance to their features that they haven't had, that really makes them feel more confident and comfortable, and that self-image and the energy you see out of it is very rewarding, and they're very thankful. I mean, it's a very gratifying space to be in in business, because people are very appreciative. So that always makes it fun if you can deliver and people are happy about it and let you know. So, and they generally do. We got some great people in this country, so it's a nice feeling.
Excellent. Well, Dr. Maas, thank you so much for joining us today. We really appreciate your insight into the report and the future of the industry. So thank you.
Yeah, well, your podcast is cool. I'm glad you invited me to come on. Thank you. Be happy to join you.
Whatever you want, we would love to have you.
Well, we look forward to talking to you again in the future. And to our listeners, thank you for joining us. We will be back soon for the next Plastic Surgery Practice podcast. In the meantime, visit plasticsurgerypractice.com for the latest industry news. Until next time, take care.